Like, share, and subscribe here on Oncology Tube to get notifications when similar videos are available.
Hi, my name is Brian Warnecke. I'm one of the second-year Hem-Onc Fellows at UC-Irvine. Thank you to Dr. Zell and the rest of MOAS for having me. The name of my presentation is called Multi-omic Characterization of RCC1 Expression and its Association with Molecular Alterations, Immune Phenotypes, and Cancer Outcomes. This was a poster that I presented at ASCO of this year. The principal investigators on this project are Dr. Al Hallak, Dr. Azmi at Karmanos, and Dr. Misako Nagasaka at UCI. So the objectives of today's discussion are to, one, identify the role of RCC1 in the development of cancer, to analyze the association of RCC1 expression with PD-L1, TMB, and the immune cell count in tumor microenvironments, and to characterize co-alterations in RCC1 overexpressing solid tumors, and then to analyze the association with patient outcomes, mainly in overall survival. So what exactly is RCC1? So it's a central player in regulating several cancer-related pathways, such as cell cycle, DNA damage response, and nuclear protein transport. It's actually a guanine nucleotide exchange factor. Regulates the nuclear expression of a protein called RAN, which is essential for normal cell homeostasis and nuclear protein transport. And the role of RCC1 is it's important in maintaining a proper gradient of nuclear RAN GTP, which ultimately, in turn, maintains the many functions of the cell cycle. And highly proliferative cells require a steep RAN GTP gradient to support its activity. Thus, cancer cells have a steeper gradient than normal cells. So the methods of our study, we analyzed tissue DNA or RNA, which analyzed with Caris Life Sciences. We included patients with non-small cell, small cell, gastric, pancreatic, and colorectal cancers. We stratified patients' RCC1 expression into quartiles. Q1 was described as low, and Q4 was described as high. And then the tissue was measured for TMB, PD-L1, tumor prognostic score, and then also NGS. And then we analyzed the overall survival data as well. So this is the demographics for our study. So in the study, there were lots and lots of patients. There were 876 patients with small cell, 21,000 with non-small cell, about 2,000 with gastric, 5,000 with pancreatic, and 14,000 with colorectal. The median RCC1 expressions were highest in small cell with 14.3 transcripts per million, followed by gastric cancer, then non-small cell, colorectal, and then pancreatic cancer. Further stratification of GI cancers demonstrated the highest median RCC1 expression to be found in colorectal cancers with microsatellite instability. So this slide demonstrates the prevalence of IO-related biomarkers in association with RCC1. So we found a positive association of TMB high rates and increasing RCC1 expression in non-small cell lung cancer, gastric cancer, and also colorectal cancer. And then the PD-L1 rates also progressively increased with RCC1 expression in non-small cell, pancreatic, and colorectal cancer as well. And the PD-L1 rates decreased in small cell, but this was not statistically significant. There were several other co-alterations demonstrated by NGS, which varied between cancer types as well. In small cell, the rates of TP53 mutations and RB1 mutations all progressively increased with higher RCC1 expression. In non-small cell, we saw that the rates of TP53, RB1, EGFR mutations also progressively increased with RCC1 expression. In pancreatic cancer, TP53 mutations and MYC amplifications were seen with higher RCC1 expression, and then in colorectal MSS, there were several co-alterations exhibiting a positive association with increasing RCC1 expression, including TP53, APC, FBX, W7, PIK3CA, MYC amplification, SETD2, POL, and MSH2. Let's get this one. I'll go directly to the clinical outcomes. So in non-small cell lung cancer, higher RCC1 expression was associated with worse overall survival. The median overall survival in these patients ranged from 550 to 788 days, ranging from quartile 1 to quartile 4. In both small cell and gastric cancer, higher RCC1 expression was not associated with overall survival. And then in pancreatic cancer, similar to the prior slides, higher RCC1 expression was associated with worse overall survival. The median overall survival was 553 to 307 days from RCC Q1 to Q4 expression. And then in colorectal cancer, higher RCC1 expression was also associated with worse overall survival. The median overall survival ranging from 1322 to 959 days. So in conclusion, so collectively our preliminary data suggests that RCC1 does play a role in cancer resistance, and it may be a potential opportunity for novel targeted drug development as well. And I'd just like to say thank you to Caris Life Sciences as well.
Like, share, and subscribe here on Oncology Tube to get notifications when similar videos are available.